N95 on either room. So you're gonna have an N95 on. She would have her N95 on, her yellow mask over top of it, her eye shield, her gown, and her gloves. So that is all that Marcia needs to go into this patient's room. She doesn't need a hairnet, she doesn't need booties. Please don't wear booties in and out of these rooms and then all around the unit, because you're just transferring COVID everywhere you walk. So don't do that. If you do wear booties, if your patient has a C. diff or anything with it, you can wear booties, but they have to be taken off with the doffing process. You can't step off of that doffing pad with them on. So Marcia's able to go into the room and do all of her skills. In between each skill that Marcia does, she's going to hand sanitize. So if there is anything that she is going to go into that room and do that you would normally put a pair of gloves onto your bare hands, she's going to put them over top of the pre-gloves that she's put on during the donning process. So if she went in to put a Foley in, she's going to go in and she's going to put those sterile gloves over top of the gloves that she has on. Right? Now, then she can remove those sterile gloves and hand sanitize, but you're going to hand sanitize in between each skill that you do. If I go in and I mess with the IV pump and change a drip or do something, hang a bag or whatever, I'm going to go hand sanitize my gloves before I go over and I do my assessment to the patient. I'm going to sanitize those gloves again before I go over and empty out the chamber on the Foley. Whatever skill you're doing, hand sanitize those gloves in between each one and or change them. So when she's all done and she's ready to come out of the room, if it is a positive patient's room, we want to make sure that we do a couple things before. Does she have any labs that need to be done while she's in there? If she does, she's going to signal to somebody. If it's a positive patient, she's going to have a spotter that's with her. She's going to signal to her spotter that she has labs that need to come out. She's going to draw those labs. She'll wipe down the tube with a wipe, bleach wipe, purple wipe, whatever. She's going to wipe the tube down with it. Let it dry for a second while she's inverting it. Put the label on it. Put it in a Ziploc bag. Wipe the outside of the bag. Knock on the door, and her spotter is going to hold another Ziploc bag without crossing the threshold. She's going to drop that tube into the Ziploc bag. The spotter is going to have a mask and gloves on. We'll seal that Ziploc bag, wipe the bag down with a purple wipe, and then it can be tubed or taken to the lab.
What if they're a rule-out patient?
I would do the same thing with labs. So the positive patient, if they have linens that need to be taken out, she's going to gather those linens. She's going to knock on the door. I'm going to hold a clean linen bag out at the door. She's going to drop it in. We're going to double bag it. If I want to be extra cautious, I can go ahead and wipe the outside of that bag down with a purple wipe. Then it can go in the regular linens. Same thing with the trash. She's going to gather the trash. I'm going to have the second bag at the door. She's going to drop it in. I'm going to tie it up. I can wipe down the outside of that bag, and then it can go through the regular trash. But if she's ready to come out, she's done all of this stuff, she's ready to exit the room, she is going to take a purple wipe or one of her wipes in the solution. She is going to wipe down the hand sanitizer in the room and the door handle. Then she's going to throw that away. She's going to make sure her hands are clean so she can sanitize those or use that purple wipe that she used the door handle and clean them with. The first thing she's going to do is, Marcia, we're going to take that gown and those gloves off. So can you please grab at the waist, at the front, do not ever touch behind the gown. Pull straight out until you feel the tie break in the back. Then you're going to have that drop. Then you're going to grab up to the top about 2 to 3 inches away from the neckline, and you're going to pull straight out. You're going to leave your arms extended the whole entire time. You're going to roll the gown away from you, and you're going to turn it inside out over top of your gloves. So we call this pack manning. Did it not right? Keep rolling. That's okay.
It's under my tail.
So you can roll it, and you're going to cup your hands over top of the second hand and pull the gown down and palm it. So if you get to this point and it does not break, she can use this gloved hand to grab a hold of the gown like this with both and pull. So there you go. Pull. There you go. Now, when that happens, she's still got her arms fully extended. The inside of the gown is now turned out and is covering her thumbs. So one thumb that is covered on her left hand, she's going to tuck it into her right hand. She's going to pull her hand free of her glove. That's her left hand. Her right hand is now clean, so she's going to take her index finger, scoop into the inside of the cuff on her other glove, and she's going to pull it straight down and deposit it into the trash can. Fight your urge to reach your hand down and push the trash into the bottom of the trash can, because this is going to waft it up at you. Then she's going to hit the hand sanitizer because she cleaned it before she started. And she cleaned the door handle down, so now she has a clean door handle to open and step out into the hallway. Now, wait, before you do that. Before she does that, her spotter is going to grab a chuck and lay out in front of the door before she comes out and steps out on it. So I would have my little chuck. She would step out onto it, and then beside her we would have a chuck under her. Beside her we have a trash can and a hand sanitizer. First thing she's going to do is hit the hand sanitizer. Then on her cart outside the room there's going to be a clean basin. She's going to lean over it, and she is going to push from the back of her goggles over her ears and push her goggles straight down into that basin. Then she's going to sanitize her hands again. Then she's going to remove her yellow mask by putting her 2 fingers behind her earlobes, making a V, and then pulling her mask straight out and down. And then she's going to deposit that in the trash can. Then she's going to go and wash her hands with soap and water before she removes her N95. To keep your N95 clean, you have to do 2 things. Wear a yellow mask over it before you enter a room, and then don't remove it until you wash your hands with soap and water. Okay? Once she removes that, she will take it straight off and put it straight into her brown paper bag to keep it clean and fold the top down. And then she's ready to go.